I'm Jamie Studts. I am a professor and behavioral scientist at the University of Colorado Cancer Center, and I co-lead the Cancer Prevention and Control Program. And my work primarily involves lung cancer in terms of implementing high quality and equitable lung cancer screening, as well as supporting the development and evaluation of new survivorship care programs that specifically target and tailor content to the individual needs of a lung cancer survivor. Lung Cancer Awareness Month is an opportunity to transition our support for the lung cancer community. Unfortunately, the societal and cultural perspectives around lung cancer are not historically as favorable as we would like them to be. We've made tremendous progress about reducing the burden of lung cancer through smoking risk reduction strategies and cessation. But this has left us with a climate where individuals who have smoked often feel blamed or shamed based on that history. It's important to note also that smoking is not the only cause of lung cancer, and there are others out there. But some of the downstream consequences of that belief system in our society is that individuals who are either at risk or have been diagnosed with lung cancer often don't experience the same level of societal support or empathy or compassion as individuals diagnosed with other types of cancer or really any other types of illness. Lung Cancer Awareness Month is an opportunity to elevate and celebrate the lung cancer survivor community, to acknowledge that they have worked very hard to support their own community and that we can celebrate that outcomes are improving rapidly, and that we can think about lung cancer differently. We can have legitimate and rational hope for long-term survival, for better outcomes, for better quality of life and well-being for those individuals who are diagnosed, as well as their families and their communities. And a lot of that is a contingent, or at least aided, by changing our societal perspectives on lung cancer. And Lung Cancer Awareness Month, or as I like to say, Lung Cancer Engagement Month, can help us communicate to our society, whether it be nationally, regionally, statewide, locally, or just our individual relationships, that lung cancer outcomes are improving. We have better treatments. We have screening. We have better diagnostic strategies. We have better symptom management strategies. And in many ways, lung cancer research is leading the entire field of oncology toward better outcomes. And that enthusiasm infuses hope and can really change how our society thinks about lung cancer and those individuals who are affected by the diagnosis. As we grow and modify our perspectives on lung cancer, we can help by attending to the words we use to describe lung cancer, the imagery that we use to describe lung cancer, and the context and where we use that language and that imagery. Outdated imagery of lung cancer tends to induce fear and shame and persists in that one-to-one relationship that is incorrect between smoking and lung cancer. We want to broaden and sort of complexify is a term I've used. I actually had to look it up in the dictionary to make sure it was a word, and it is a word. But to complexify our understanding of lung cancer, that it's not as simple as the two things that our society knows about lung cancer, which is it's caused by smoking and the outcomes aren't good. When we recognize that those aren't the full story, we enrich our understanding of lung cancer, we diversify our understanding of lung cancer, and we see that outcomes are recognize that outcomes are improving and that it's not a shame or stigma-based situation. Those are unhelpful in terms of our efforts to reduce the burden of lung cancer. And to the extent that we can remove stigmatizing or fear-based language, stigmatizing or fear-based imagery around our lung cancer engagement efforts, we're starting to work toward a community that is more supportive, that is kinder, gentler, more engaged, and rallying around those who are impacted by this illness. We often refer to November as Lung Cancer Awareness Month, but I like to think of it as Lung Cancer Engagement Month. There are so many wonderful things happening that support our community during this month. We are having celebrations of lung cancer survivors, from grassroots to hospital-based to statewide entities and organizations, and even national organizations that contribute to the dialogue of normalizing the communication and discussion of lung cancer. There's National Lung Cancer Screening Day, where it is many of our lung cancer screening programs open up on a Saturday in November to expand access, but also to build engagement, to raise awareness, to communicate to the public that lung cancer screening is an opportunity for individuals who are eligible. And it draws just a little bit more attention when you have that kind of rallying cry. So the American College of Radiology and the National Lung Cancer Roundtable, supported by the American Cancer Society, have worked very hard to raise the engagement through this National Lung Screening Day. And there are sites that will be open nationwide to really support those individuals at risk and bring more of a community feel to how we interact with those individuals who are at risk, as well as the lung cancer survivor community.